An ectopic pregnancy occurs when a fertilized egg implants and begins to grow outside the main cavity of the uterus, most commonly in one of the fallopian tubes. This is a medical emergency because the developing embryo can cause the fallopian tube to rupture, leading to severe internal bleeding and potentially life-threatening complications. Causes of ectopic pregnancy. An ectopic pregnancy can result from anything that interferes with the movement of the fertilized egg through the fallopian tube to the uterus. Common causes include damage to the fallopian tubes, scarring or inflammation due to infection, surgery, or previous ectopic pregnancies. Hormonal imbalances, abnormal levels of reproductive hormones that affect the movement of the egg. Congenital defects, structural abnormalities in the fallopian tubes or reproductive system. Intrauterine devices. IUDs. Rarely, pregnancies that occur with an IUD in place are more likely to be ectopic. Previous surgeries. Pelvic or abdominal surgery can cause adhesions that increase the risk. Smoking. Smoking increases the risk of ectopic pregnancy by affecting the function of the fallopian tubes. Risk factors. Previous ectopic pregnancy. Pelvic inflammatory disease (PID), often caused by sexually transmitted infections, STIs like chlamydia or gonorrhea. Fertility treatments such as in vitro fertilization, IVF. Tubal surgery such as tubal ligation or tubal reconstruction. Age over 35. Smoking. Symptoms of ectopic pregnancy. Ectopic pregnancy symptoms usually appear between the 4th and 12th weeks of pregnancy. Early symptoms can be mistaken for a regular pregnancy or miscarriage. Key symptoms include sharp or stabbing abdominal pain, often on one side of the abdomen, but may spread to the pelvis, shoulder, or neck. Vaginal bleeding, light bleeding or spotting, which may be mistaken for a normal period. Shoulder pain, caused by internal bleeding that irritates the diaphragm. Dizziness or fainting, caused by blood loss from a ruptured fallopian tube. Nausea and vomiting, due to the abdominal pain. Diagnosis. Diagnosing an ectopic pregnancy involves a combination of physical examination, a pelvic exam to check for pain or tenderness, blood tests to measure human chorionic gonadotropin (HCG) levels, which rise more slowly in an ectopic pregnancy compared to a normal pregnancy. Transvaginal ultrasound. This imaging test helps confirm the location of the pregnancy. In an ectopic pregnancy, no pregnancy will be seen in the uterus. Laparoscopy. The minimally invasive surgical procedure to view the fallopian tubes and confirm the diagnosis in uncertain cases. Treatment options. 1. Medication. Methotrexate. Methotrexate is a medication that stops the growth of rapidly dividing cells, such as those in an ectopic pregnancy. It is used when the ectopic pregnancy is diagnosed early, and there is no immediate risk of rupture. Advantages: non-invasive, avoids surgery. Disadvantages: requires close follow-up with blood tests to ensure the pregnancy is resolving. 2. Surgical treatment. Surgery is necessary if the ectopic pregnancy is more advanced or if the fallopian tube has ruptured. Laparoscopy. The minimally invasive surgery where a small incision is made, and the ectopic pregnancy is removed. The fallopian tube may be preserved or removed depending on the severity. Laparotomy. The more extensive surgery performed in emergencies, especially if there is significant internal bleeding. 3. Expectant management. In some rare cases, if the ectopic pregnancy is very early and not causing significant symptoms, doctors may closely monitor the patient to see if the pregnancy resolved naturally. Complications. Ruptured fallopian tube. If left untreated, the growing embryo can cause the fallopian tube to burst, leading to life-threatening internal bleeding. Infertility. If the fallopian tube is damaged or removed, it can reduce fertility. However, many women can still conceive successfully with one functioning fallopian tube. Future ectopic pregnancies. Having one ectopic pregnancy increases the risk of another ectopic pregnancy. Recovery and follow-up. Physical recovery. After surgery or medication, most women recover physically within a few weeks. Pain and discomfort may persist for a short time. Emotional support. An ectopic pregnancy can be emotionally distressing. It's important to seek support from loved ones, counselors, or support groups. Future pregnancies. Many women go on to have successful pregnancies after an ectopic pregnancy. It's important to talk with a healthcare provider about family planning and future pregnancy risks. Prevention. While there is no guaranteed way to prevent an ectopic pregnancy, some measures can reduce the risk. Early treatment of STIs. Prompt treatment of sexually transmitted infections reduces the risk of pelvic inflammatory disease (PID), which can cause scarring in the fallopian tubes. Quit smoking. Smoking cessation lowers the risk of ectopic pregnancy. Careful monitoring after fertility treatments. Women undergoing fertility treatments should be closely monitored in early pregnancy to check for signs of ectopic pregnancy. When to seek medical help. Seek immediate medical attention if you experience severe abdominal or pelvic pain, especially if it is sudden and sharp. Heavy vaginal bleeding, dizziness, fainting, or severe weakness. Conclusion. An ectopic pregnancy is a serious condition that requires prompt medical attention to prevent life-threatening complications. Early diagnosis and treatment are crucial, and with appropriate care, most women can recover fully and maintain their fertility.